Hello, my name is Joseph Little, and I'm introducing the team that researched data analysis of the impacts of COVID-19. Our STEM fellows are Natalie Brown and Jose Pina. I was accompanied by Mr. Tony Stanford, and I would like to introduce first Natalie Brown, who will be covering the subtopic of domestic violence.
Hello, my name is Natalie Brown, and I will be covering domestic violence and the impact that COVID 19 had on domestic violence. The pandemic of COVID 19 has been a threat to our society over the last 2 years with still no ending in sight. While death cases and hospitalizations have slowly decreased, the effects of the pandemic will leave a lasting effect for years to come. Domestic violence has been an issue for centuries. However, during the pandemic, numbers have rise significantly. The increases has almost doubled, sometimes tripled, nationally and globally. By looking at our chart, you can see the increases shown around the country, such as San Antonio, it jumped to 18%, Portland, Oregon, about 22%, and New York City, 10%, just to name a few. These increases are because of the lockdown measures taken when the pandemic first hit. A lot of stressors contributed to domestic violence increases, such as job loss of either one or both parents, school closings, and lack of movement. All of these prevented victims from escaping, seeking help, and reporting domestic violence. Firearm sales has increased since March of 2019, up to about 85.3% as of March 2020, which increased accidental, intentional injuries, or some cases death against women and children. There are a few cases where victims were able to escape during the pandemic lockdown, but there were more which victims suffered alone and in silence. Overall, based on 12 US studies, domestic violence incidents increased 8.1% after lockdown orders. That number may seem to be small, but that's a huge jump simply due to the pandemic. Now, I'll be introducing you to Jose, my research partner.
Thank you, Natalie. So, as we can see, we have a chart here for the distribution of learning impacts. We can see that this chart shows us how far behind our students are in regards to math and reading. Students tend to be more behind on math than in reading. We can see that students are 5 months behind in math and 4 months behind in reading. And also, this graph shows us that the groups are disproportionately affected. Students in majority black schools are 6 months behind in math and reading, while students in majority white schools are 4 months behind in math and 3 months behind in reading. Similarly, similar disproportionality can be seen in the income section and in the location section. Also, we see that students in 2020 saw a drop in 5 to 10 percentile points when they are compared to students in the same grade from 2019. Moving on to work and well-being, by April of 2020, restaurants, parks, shopping centers, and other public places had experienced a global drop in attendance of almost 60%. Workers had begun to classify themselves as inactive or out of the labor force, meaning that they didn't want to go back to work due to probably sheltering in place or other things. And they also had to reduce their hours, now working part-time jobs, causing millions of full-time jobs to be lost. And if it tends to be that if you are unemployed, you tend to have less money, therefore less life satisfaction. The differences between the countries, however, is a little bit more impactful. Since March of 2020, workers from lower income countries experienced 43% larger reduction in workers from a higher income countries. And workers in developing countries, because they have less access to internet, were less likely to work remotely, therefore were more likely to lose their jobs when compared to countries of higher income. And now I would like to hand the presentation back to Natalie to continue with mental health.
Anxiety and depressive disorders have always been the number one mental health issue in the United States. However, during the pandemic, those numbers have increased considerably between June and August of 2020. During the beginning months of 2020, a survey was conducted to see how the pandemic has impacted mental health. From January to June of 2019 to 2020, the numbers jumped from 1 in 4 adults to 4 in 10 adults that have experienced some form of mental health disorders. Due to these disorders, the United States saw an increase of suicidal thoughts and substance abuse. In young adults between the ages of 18 and 24, the numbers doubled from 2019 to pandemic time due to colleges and universities closings and loss of wages. Substance abuse increased to 25% from 13%, and suicidal thoughts increased to 26% from 11% in 2019. Adults who experienced job losses reported also higher rates of symptoms of anxiety and depressive disorders, jumping from 32% to 53%. Because of school closings and lack of childcare, women with children numbers jumped from 40% to 49%. And due to lack of access to healthcare, communities of color suffered significantly during the pandemic. Essential workers also experienced an increase of mental disorders due to uh, thinking that they will contract the disease, having to be out there, having to work, even though there's a wide range of pandemic going on. So that those numbers also increased during that time. It increased overall from 30% to 42%. So basically, substance abuse increased from 11% to 25%, and suicidal thoughts increased from 8% to 22%. So as you can see, that was a big impact in mental health disorders, from all groups of humans. So now I will turn it over to Jose for our conclusion.
So, in conclusion, we can see that from our research, COVID has had a huge impact on domestic violence, education, work and well-being, and mental health, apart from other things that we didn't get the chance to research. It is important for us to continue to recover from this stage in life that we all experienced and come together as humans in order to get better and catch up on our education, help people in domestic violence situations, fix our job statuses, and help to regain our mental health. So thank you so much, and have a good day.